Hi, my name is Bianca. I'm Dr. Stark's nurse, and I'm going to go over a little bit of information what to expect after your breast augmentation or your mastopexy. So the day of surgery, make sure you have somebody that's going to pick you up and stay with you, help you with your essential needs after surgery. For the most part, you're going to be pretty independent, being able to use the restroom by yourself, but it is nice to have a little bit of help. So after surgery, you're going to go home with a big ace bandage wrapped around your chest. That's going to decrease the swelling and any risk of bleeding. Once we see you the very next day at your post-op visit, we'll take that ace bandage off and put you into a sports bra or kind of a compression bra that zippers or buttons in the front. We're gonna leave those tapes on there, and then you can go home and you can shower the very next day after we see you. Those tapes can get wet, pat gently dry, and then put your bra back on. You wanna make sure that it's not rubbing under here and not causing any friction, because that tissue is very fragile, especially if you've had a breast lift or if you did an augmentation and the entry point is the mammary fold. About 7 to 10 days after your surgery, we will take the tapes off and then take any sutures that you have out. That skin is still pretty fragile, so there's still no lifting, bending, or straining. Normally, patients resume activity closer to 3 weeks after, but if you have any questions or concerns, just give us a call. You can always send us photos, but we will keep track. We want to make sure that the skin is completely healed before you begin any activity. Scars on a breast lift typically take about a year to completely fade. After about 2 to 3 months, you can use any scar tape. We like the silicone scar tapes. We think the silicone ones work the best because it's constant adherence to the skin, but you don't want to be too early on those, so be sure to ask us if you have any questions, if you wanted to use them sooner rather than later. Things to look out for after your procedure, typically the day after the procedure, is if you're having a lot of pain in the underarms. Having some pain in the breast is completely normal. We put an implant under there, so having that pressure is extremely normal. You can take 800 milligrams every 8 hours of either Advil or Motrin. That will help decrease a lot of that inflammation. You can take that 1 hour after you take your Norco, which we typically prescribe patients. But if you have any extra pain in the underarms, or if one breast is looking larger than the other, just give us a call and you can always send us a photo. Breast augmentations are one of our favorite surgeries here at Stark Plastic Surgery, so we're excited for you and we hope you have a good time healing.